about to work to actually start treating your children. Then, hello and welcome to the Well Child Show. Big things, they say, come in small packages, and as complex as the human body is, a really small gland plays a very prominent role in the functions of every cell in the body. You're welcome to the Well Child Show. My name is Kemak Onyenuchea, your host. Today on the show, we'll be looking at the thyroid and its dysfunctions in children. I'm going to take a breather. When I return, I'll introduce my guest and the Well Child Show continues. Don't go away. Thank you for staying with us, and I welcome you to the Well Child Show. If you're just tuning in, I have a very special guest today in the studio. He is a public servant as well as a social worker. His name is Goriola Erogbogbo, a social entrepreneur, economist, and public servant with over 14 years work experience spanning the private, public, and the non-profit sectors. He's the founder of the LAYI Erogbogbo Foundation, Africa's a leading social enterprise with an interest and focus on providing support, funding free surgeries, and visibility to endocrine diseases, such as goiter. Goriola holds an MBA from the Stephen Ross School of Business at the University of Michigan, where he was awarded the Dean's Full Tuition Scholarship Award. He also holds a BSc in Economics from the University of Lagos and was recognized in 2015 as an Archbishop Desmond Tutu Leadership Fellow for outstanding contribution to the development of Lagos State, and in 2017 was selected by the U.S. Consulate in Nigeria to attend the prestigious International Visitors Leadership Program themed Transparency, Ethics, and Accountability in Government in Washington, D.C. Join me as I welcome the founder of the LAYI Erogbogbo Foundation, Mr. Goriola Erogbogbo.
Thank you so much.
Thank you so much for being with us today.
Thank you so much.
I follow your work and the great things you're doing in the health sector of the social space in Nigeria, and I must say kudos on all that you do.
Thank you.
So today we're looking at thyroid dysfunction in children. I'd just like to start off with a little introduction, and I have a resource that I would appreciate to pop up on the screen so that the viewers can be a part of that. Can you just tell us a bit about the thyroid? What exactly is a thyroid and where is it located in the human body?
Thank you so much, and thanks for having me on your show.
It's my pleasure.
So the thyroid gland is in front of the neck, just below, very close to the Adam apple. And basically the thyroid gland, it's a gland that promotes the metabolism and chemical processes in the body.
Okay.
So it regulates the cells, the tissues, and organs in the body generally.
Okay, so now when we look at the thyroid dysfunction, there are basically two types. Can you give us a detailed analysis of the two types of thyroid dysfunction in children, as well as the symptoms that parents can look out for in their children?
Thank you.
Yeah, please pop up the resource on the screen.
Okay, so basically you have two types of thyroid disease. It's hypothyroidism. When you mean you have hypothyroidism, this is when the thyroid gland is underactive. And the other one is hyperthyroidism. This is when the thyroid gland is overactive in the body. And some of the signs of when you see someone who has hyperthyroidism is that one, you see some sort of weight loss. There will be bulgy eyes. The person will be really, really hyperactive. So someone who has a hypothyroidism, you see sudden weight gain. You just see that there's so much, there's slow pulse. The person is really not ready for too much activity, always tired and all that. So those are the two major things you see in thyroid gland, basically.
Okay, so let me just give a disclaimer to parents watching. Now, it doesn't mean that when your children are observed to have these symptoms, you jump to conclusion that they're having a thyroid problem. Like we always advise on the show, make sure you consult your doctor or medical professional in taking any medical decision. Now, Gori, the thyroid is a really small part of the human body, but has a lot of functions. Can you tell us a bit about the functions of the thyroid in the human body?
So basically, what the thyroid gland does is that it produces thyroid hormones into the blood, which secretes into the blood, basically. And that regulates the cells of the body, the tissues, and the body systems generally. So the thyroid function is a major, the thyroid gland is a major gland in the body. It helps to regulate the heartbeat, the nerves, helps to regulate fat in the blood, helps to regulate child development, learning and development in children, basically.
Okay. So now looking at the prevalence, do you have any statistics on the prevalence of thyroid dysfunction in children?
So what we've seen generally is that you see it's very rare in children, and you see maybe 1 in every 4,000 children. Yeah?
Okay.
So let me break some things down here. We have something called congenital hypothyroidism. This is a thyroid disease that happens in, when a new baby is born.
Okay.
And what typically happens is that it's possible you see an infant that is born without a thyroid gland at all.
Okay.
Or the thyroid will be abnormal, so that it won't really be producing thyroid hormones like that. That's in an infant, yeah. And what really causes that is that there's usually enzyme defects, iodine defects, and also, you know, the brain pituitary gland is abnormal and all that stuff. So you start seeing some symptoms. Another form is you see hyperthyroidism in children as well. That means they are very, very active. They are very, they are noisy. They are not stable. They have they have high heartbeats. You know, they are not just stable. They want to do everything and all that stuff. So it's always good to check. So another thing is you also see Hashimoto's thyroiditis. Yeah.
Okay.
So this has to do with the autoimmune system, basically. So you find a situation whereby the autoimmune system is fighting the thyroid gland in the body, really. And it's so, and that results from the thyroid gland not also producing enough thyroid hormones. And the only way you can correct that is that, you know, they have this medicine called thyroid hormone replacement, thyroxine. So they give the infants, and, you know, over time, it outgrows the condition over time.
Okay, now I know one of the things, or one of the symptoms, the most glaring symptom of, I think that's the hyperthyroidism, is the goiter.
Yes.
That's the swelling on the neck.
Yes.
Okay, can you tell us a bit about that, especially as it relates to children? When the child is observed to have that swelling on the neck, which is again a symptom, not an express medical diagnosis that there is a thyroid problem, what steps do you think parents can take? You know?
So usually you start seeing the child complaining of you know, having difficulty in swallowing things. There's voice hoarseness. The person can't talk very well, and the usual thing we always tell them is to go to see the physician. Usually we're supposed to go and see a pediatrician endocrinologist. These are specialists in this field. They are, you know, they're trained to, especially for children and all that stuff. So what we tell people to do is probably, you know, go to the physician, do a thyroid scan, and there's something they also call, you take, they take samples of the thyroid gland itself to know what is the real cause of the thyroid.
That's like a biopsy.
Yes, like a biopsy. So they do a fine needle aspiration, in medical terms, fine needle aspiration. So they take a biopsy of the gland, they take it to the lab to know what caused it before they take necessary steps. So we've seen 2 cases at our organization. One was a thyroid cancer. So a student was brought to our foundation. He was having difficulties breathing. You know, the thyroid gland was already blocking his windpipe and all that. So they had to do an emergency surgery for him. So they took off one of the lobes of the thyroid gland, and we took it for histology and all that, and discovered it was thyroid cancer and all that stuff. So in the next few months, we're going to do another surgery to take off the whole thyroid as well.
Okay, now I know we live in a part of the world where there's so much emphasis on things like cultural beliefs, superstitious, ideologies and stuff. Can you tell us a bit about some superstitious ideas or superstitious beliefs that, accompanies thyroid disorder, especially in children, so that our viewers would learn?
Okay. So, so that's a bit. So what we've seen generally is that people say, the guy, if it's a boy, they say, this guy, are you sure he's not a witch? Or are you sure someone is not, they've not placed a curse on him and all that stuff. So people start running away from the kid, the stigmatization. People start saying all sort of stuff that, there's some family that's behind, the scenes affecting and all that stuff. But mostly it's never the case, mostly. Usually when the parents give birth to these children, they're supposed to take them to go and do some thyroid function tests, which a lot of people don't do. So they see, in Nigeria, you see symptoms of things that you think everything is malaria, everything is ulcer, petty things like that, and we don't do necessary steps to. So usually when you give birth to a child, one of the first things you need to do is also take a blood sample to go and check the thyroid functions, because the thyroid gland helps with the growth and development of the child itself. So once it has defects from childhood and you don't do anything about it, till he keeps on growing, he will keep having different issues. At the end of the day, it gets out of hand, then you see the enlarged thyroid and people say all kind of things. So it's never the case, basically. One of the most things that cause this thing is lack of iodine. Lack of iodine, people living in mountainous areas, people living where places are really flooded and all that stuff. And another thing is that there's a mineral nutrient that's missed in your food called psyllium. Once it's missing, it also affects the goiter, affects the thyroid gland as well too.
All right, so we're going to go on a quick break, and when I return, we'll continue the show. Okay. Viewers, don't go away. We're discussing thyroid dysfunctions in children. I have a little video that delves a lot into the thyroid and the function of the thyroid in the human body. Let's take a listen, and the Well Child Show will continue on the other side.
The thyroid gland is located in the front of the neck, just below the thyroid cartilage known as Adam's apple. It is composed of 2 lobes on either side of the windpipe. Despite its small size, the thyroid gland has an important task. Thyroid gland produces hormones, which are important for the growth and energy metabolism of the body. The production of thyroid hormones is controlled by another hormone called the thyroid stimulating hormone, or TSH. TSH is secreted by the pituitary gland in response to the stimulation from the hypothalamus in the brain. The thyroid needs iodine out of nutrition in order to produce thyroid hormone. There are 2 primary thyroid hormones produced by the thyroid gland: thyroxine, also called T4, and triiodothyronine, which is also known as T3. The numbers 3 and 4 found in their names indicate the number of iodine atoms in each hormone. T4 is inactive and is converted by the body into its active form, T3. Thyroid hormone is transported by the blood to the tissues of the body, where it acts. Thyroid hormone plays a key role in all processes of the body, specifically in the growth, development, and energy utilization. Deficiency of thyroid hormone causes delay in these processes, while excessive thyroid hormone can lead to a malignant acceleration of such body processes. In another animation, different thyroid problems and their treatment options are explained.
You're welcome back. It's still the Well Child Show, brought to you by Global Child Health and Safety Initiative. My name is Kemak Onyemichea, your host, and I have with me in the studio Mr. Goriola Erogbogbo, the founder of the LAYI Erogbogbo Foundation. Thank you for being with us today.
Thank you for
All right, now before we go further, I'd just like to find out a little bit, like your foundation, you're dealing specifically with issues relating to the thyroid and thyroid dysfunctions. Can you tell us a bit about the history of your foundation and the reason why you do the work that you do?
So while I was in the university, when I was like 17, 18, my dad had a thyroid issue, and we all discussed about it, and he had a surgery in the hospital in Lagos here, and just 2 days after the surgery he passed away. So ever since I had developed that thing in me that I was going to find out what is causing this problem and how can we solve this problem. So over time, when I went to the university, I did my MBA, I moved back. I said, I was going to put an end to this. So we started the LAYI Erogbogbo Foundation in conjunction with my mom and my siblings and all that. So we went in depth to find out what was causing this disease and how can we help people not go through what we went through and change people's lives who have thyroid disease. So this is how we came to helping people who have this.
That's really fantastic, and again I say kudos on the work you do.
Thank
now
you so
for
much.
the benefits of our parents who are watching, I know behind the scenes we were talking a bit about symptoms that parents can look out for in their children that can be a pointer to the fact that there may be a problem with the thyroid of the child.
Okay.
Now, can you mention a few symptoms that parents should look out for in their children that would spur them to get further medical advice?
Okay, so usually sometimes you see that the child is just tired, not eager to do anything. That's one symptom. There's decreased crying. You just see that normally at this age the baby should be crying and all that stuff, and it's just quiet and all that. That's also a symptom. There's always constipation, diarrhea, there's loss of appetite. You see that the baby just doesn't want to eat anything. It's also a sign that if there's there's anxiety, if the baby is just always eager to do something, there's so much adrenaline in the system and all that stuff. It's also a sign. There's when you see fast heartbeat, you see that or you see that there's extreme weight loss, extreme weight gain. These are simple signs that you need to go to the hospital and check for the thyroid function.
All right. Now, speaking about mothers and their children,
Okay.
I wanna ask: is this condition something that can be transferred from a pregnant woman to her baby?
Yes.
A thyroid dysfunction.
Yeah. So I mentioned earlier on, usually it happens with hyperthyroidism in children, basically. So when the mother has Graves' disease, that's when the autoimmune system, when the antibodies of the mother travels from the placenta of the mother through the bloodstream of the children, goes into the thyroid gland, it can also affect the child. But depending on the strength of the antibodies, basically, if the antibodies is so high, at some point you need to take some drugs to take the antibodies off. But if it's so low, within 1 or 2, 3 months, it will wear off itself and the baby will be okay. So it does happen sometimes that a pregnant woman who has Graves' disease, that's autoimmune thyroid disease, it can also affect, but it's treatable if it's detected early. There's something we call anti-thyroid drugs. You can easily give the child, and you will have faster growth and all that stuff. But basically, you should also look at those symptoms I've mentioned earlier, because those are early signs that the baby is coming up with the thyroid issue, so that they can easily nip it in the bud.
Now, the thyroid is a really important function. It seems like the epicenter of all the glands in the body.
Yes.
Because the thyroid hormone that it secretes is responsible for the optimal functioning of every cell in the body. Now, I'm moving on to the next question. Are there some preventive measures that pregnant women can take to ensure that this dysfunction does not pass from them to their children?
Okay, so usually in our geography here, what we advise people to do is, one of the main causes is lack of iodine. So we ensure that, when you're buying your salts, you buy those brands. Nigerians were used to buying all these hip salts that you see people, no brands and all that stuff. So we go for the brands that have iodized sign on them. If you take them, when you're cooking and all that stuff, ensure, you take iodized salt. That's one of the very, 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 very major steps you need to avoid having a thyroid disease. Yeah. And sometimes, people that live in, flooded areas. So for instance, flooded areas where they plant stuff. So let me give you an instance. In 2014 in Badagry, the government discovered that there were a lot of people in Badagry who had these thyroid issues. And one of the things that was causing it was that it was from, first of all, was from cassava. Okay. So when cassava is not really processed very well, that's the gari we take and all that. People, once it's not processed very well, it also affects the thyroid gland. So you should make sure that, when you're buying gari, which we all eat here, is really, really, really processed very well. And it does, because what happened in Badagry was they were all eating cassavas that wasn't really processed very well. So about 80 or 70 people had that condition. Everybody had protrusion on their neck. Wow. And the state government had to do an intervention to try to do surgeries for all of them. So that's how we discovered that, the hospital, there's a certain hospital that is good in doing these surgeries for people, and that's why all our patients are going to the hospital to do those surgeries.
Yeah. So, and this is also a call to, merchants that produce consumables that the average Nigerian uses. Let's have good faith. Let's have good conscience in producing all these foods that people eat, and make sure that the required nutrients are, in those food substances, especially for our children, to reduce the incidence of diseases such as the goiter and other thyroid dysfunctions. Now, moving on from that, I know you've mentioned the surgery to treat the goiter disease.
Yes.
Are there other means through which this disease can be handled apart from the surgery?
So again, it depends on how early you've discovered this. Yeah. So like I said earlier, we have hyperthyroidism and hypothyroidism. Usually when you see people who have hyperthyroidism, you usually see that they have bulgy eyes here. So you can't easily do the surgery. That means their thyroid gland is producing excess thyroid hormones. They need to take some drugs to step the thyroid hormones down before surgeries are done. But when it gets to a stage and it's a bit enlarged, surgery is usually almost the last thing the surgeons want to do to take it out. So another thing you see that people are in a rush to just do surgery because they've seen protrusion on their neck. So in our organization, we don't advise like that. So we all just go with the advice of the physicians. Whatever they tell us, we just abide by that. So you see some people, they come to us and say, hey, we want to do this surgery quickly. I'm like, no. Sometimes you need to take some drugs for like 3-4 months. There's also something called radioactive treatment, which is very frequent in Nigeria because there have just been 1 or 2 hospitals that have the equipment here. So usually they use radioactive treatment to try and reduce the size of the thyroid gland. It was extremely expensive in Lagos here. So most people can't afford it, and sometimes have to resort to just doing the surgery and
just get it over with
and get life over with. Or sometimes, if they do the surgery, sometimes you have to be on a certain drug for the rest of your life because you need to take a thyroid replacement drug that's going to be performing that function of the thyroid gland for the rest of their life. So sometimes we advise them that it's better the thyroid gland doesn't get cancerous and you're taking this drug than keeping that thyroid will swelling your neck for ages and all this stuff.
Okay, we're going to talk about prevention, but that will be after the break. So let's go on a quick break and we'll be back shortly. Please don't go away. You're welcome back. If you're just joining us, you're watching the Well Child Show with Kemak, brought to you by Global Child Health and Safety Initiative. And I have a public health enthusiast and a social worker in the studio today, and we're looking at thyroid dysfunction in children. Welcome back, Gori.
Thank you.
And thank you so much for being on the show today. All right, before we went on the break, we were talking about preventive measures. What advice do you have for parents in, be it nutrition or lifestyle changes, that parents can adopt to make sure or to prevent their children from falling prey to thyroid dysfunction?
So, there are a lot of foods that have iodine content in there where a lot of people don't even know. So, for instance, bananas, mangoes, apples. These are, cheap fruits that you can easily buy that, have iodine substance in it, and even buying iodized salt too. So when you're cooking, ensure that, there's some sort of iodized salt in your body. You're cooking with iodized salt. Another thing is that it is also good to go for that thyroid function test to know your thyroid levels. If you need to be taking more iodine stuff, or you need to step it down a little bit. But those are the easy, quick wins. You can easily, low-hanging things you can quickly eat, and just eat them constantly and do your thyroid functions once in a while. I'm sure you'll be fine.
All right. Now, let's talk a bit about your foundation, the LAYI Erogbogbo Foundation. I follow you on social media, and I see the great work that you do, especially in the area of free surgeries and health interventions. Can you tell us a bit about how you are able to raise funds and pursue the activities of your organization?
So I'm a diet person. Once I want to do something, I go for it. I don't think about the problems. So when I wanted to start, people were saying, "Oh, you're going to get funding. You're going to get." I'm like, let's start. So what I do is that I know there's a problem. We have a lot of people who are suffering from this disease, and I know that there's a gap. There's a problem. There are people who can support, but the people who need this can't find people.
They're coming together.
So we have just come to bridge that gap. Say, hey, we are credible, we are good. Come, patients come, we'll get you people to solve this problem. And what we do is that our social space, in social media, we share those experiences. There are live interviews, there are witnesses, videos. People see what we are doing. So it's a quick win. People just call us, tell us, hey, we like what you're doing. Can we support one patient? Can we support two patients? It's still difficult, but sometimes, sometimes I just get a call, hey, we've been seeing you, we've been following you for a year. We'd like to support you. How many patients do we have? So I just connect them with the patients, and because people can see what we are doing, we are not telling them we are treating 4,000 people, and people can
then it's
see.
Just 3.
Yeah, exactly.
Yeah.
People can see, so they can see what they are paying for.
Which is really crucial, that element of integrity.
Exactly. And you see a patient who has a protrusion on her neck. Under 2 days, the protrusion is gone. And even 6-7 months after the surgery, they do come back to give us live testimonies and all that stuff.
Wow.
So that's we still want more people to come and support us, because we have so many people. Every day when I wake up, calls and calls.
It's a passion for you.
It's a passion. And,
wow. Goriola, thank you so much for all you do for the average Nigerian, and thank you for coming on the show.
Thank you so much.
All right, so we've come to the end of this edition of the Well Child Show, but the conversation still continues on all our social media platforms. You can hook up with us on Instagram at the Well Child Show and at Global Child Health. We have past episodes and this particular episode on our YouTube channel. You can be a part of that at Well Child TV. And then if you have questions, suggestions, and for training and consulting opportunities, you can send us an email at info.wellchildshow@gmail.com. Thank you so much for being a part of the show today. And like I always say, always remember, child health and safety is everybody's business. I'm Kemak Onyenuchea. I'll be back next week on another edition of the Well Child Show. God bless you. Goodbye.